Thanks for standing by and welcome to the PainChek Investor Webinar and Q&A following the company's quarterly update announced this morning. Additionally, I'd refer everyone to yesterday's announcement regarding reimbursement in the US, and this is something that we'll drill down on further during the webinar. There'll be a presentation lasting for approximately 25 to 30 minutes, followed by Q&A. So if you have a question you'd like to submit, please feel free to type it in using the Q&A function within Zoom, and we'll get to those after the presentation. On behalf of PainChek today, we have the CEO and Managing Director, Philip Daffis. I'll hand it over to him now.
Thank you, Matt, and thank you everyone for attending today. Appreciate your time and the effort to be with us. Very excited to talk about our update this quarter and also to talk in more detail, as Matt mentioned, about the existing finding of the reimbursement opportunity for us in the United States, which we believe is a significant game changer for the business. For those who are new to the story, PainChek's purpose is to give a voice to those people who can't reliably verbalize their pain, and that includes people at one extreme, people living with dementia and cognitive impairments in, say, long-term care facilities, aged care facilities, who have lost that ability to reliably verbalize and communicate. And on the other extreme, we have an infant's version for pre-verbal children who, of course, not yet built that ability to communicate. Both products are on the market. Our key focus today will be on the adult because we've just launched in the United States and we've just got this situation where we've got a great reimbursement opportunity for the adult product. So big focus on that today. If you look at the adult product itself, the PainChek adult product is regulatory cleared in many markets now, including FDA clearance for the United States. It's an app, medical device app that can be used on any smart device. It's iOS or Android based. It's easily accessible and used at the point of care, which is where you should use this technology, and it identifies pain in an objective manner. It gives a score of no pain, mild pain, or severe pain, or moderate pain and severe pain, and it also gives a pain score that allows people to actually adjust and adapt the therapy to the patient. The app itself integrates with care management systems, as well as to our web portal, which means we provide great data analytics to our clients as they use the product. So we're now embedded in close to 2,000 aged care facilities around the world, and we're growing with more than 17 million pain assessments conducted as of the end of January. And of course, PainChek is now seen to be validated and accepted as best practice to assess pain for this patient cohort. Since inception as a business, our goal was always, we started in Australia, validate the product in Australia, we went to the UK, and now going into Europe to further penetrate and further validate the model and get the business model right. But the big goal for us was always North America, the United States in specific, because that's the largest the largest healthcare market in the world. And to be a real global success, you have to be in the United States. And as you will see today, not only are we in the United States, yes, it's very early days, but we have a competitive advantage that's going to stay with us for many years to come as we penetrate the United States. So before we get into that, let's quick summary in terms of the last quarter's results. Overall, in the quarter, licenses remained roughly the same, around 115,000 beds, which is worth about $5.6 million contracted ARR when all licenses are implemented. And as you'll see, we have close to a $2 million ARR pipeline. The last quarter of the year is always typically slower. We did grow in beds, but that was also netted out by some small losses in the UK and Australia, mostly due to client consolidation and acquisitions. So overall, we have more than 100% retention overall when it looks at the net license situation. In Australia, we have close to 70,000 licenses, around 3.1 million. We've introduced price increases in the last quarter for all renewals. And all our new agreements, both in Australia and the UK, are on our new activation contracts with committed start dates agreed on signature with the customers. So engagement levels are very high in aged care and home care providers, with more than 25 active proposals out there in the marketplace in Australia. In the UK, which is a mix of these numbers in here, We've got great results from the Scottish Care Inspectorate. We had a meeting with the Scottish Care Inspectorate this week, and you will see a release today that talks about the value of PainChek and how it's impacted care in Scotland as we continue to negotiate on that situation. And the Royal Edinburgh Systems agreement is ongoing and phase 2 of the pilot project. I would add, in terms of the UK, the operations teams have been actively involved in early renewals, and we've got a significant number of our clients in early renewal going from 1-year agreements to 2-year agreements, and many of them were signed up towards the end of last year. You'll see that detail in the quarterly. If we now look at implementations, well, as you can see here, the total implementations continue to increase nicely. We are now at 51,000 implemented beds, worth $2.4 million by the end of January. And during the last 2 months, we've actually had significant implementations. We've implemented at Calvary Care for 5,000 beds, Helping Hand 800 beds, Catholic Healthcare 2,500 beds, and also in the UK, Lovett Healthcare for 2,000 licenses, and also Exemplar Healthcare for about 3,700 licenses. So implementations continue to increase significantly, and we have seen that our customers stay with us long term. Close to 60% have been with us more than 3 years, and 31% of our clients now have got contracts of a minimum of 2-year period. So implementation's growing really nicely. In terms of the pipeline, you can see here in the graph itself, there's about 1.9 million ARR pipeline. That's a qualified pipeline. These are customers that are in negotiation, and we should be completing the next few months across most of the UK and Australia and New Zealand, but some also in the US. The qualified pipeline is not just aged care, it includes home care, disabilities, some hospital agreements, and they all run with the new tiered activation program, which means we get revenues in faster. Outside of that number, it's early days in the US, but we have got a 30,000 bed pipeline opportunity, which is being qualified by our team right now. So we'll see that number increase as the US switches from early stage identification of opportunities through to the qualified pipeline. Very quickly on the PainChek Infant, there's a good summary of it in the actual Word documents released today. But the goal for infant is to make infant pain visible for mums and dads and carers who look after pre-verbal children. The product was designed more as a consumer product. It's just as a 3-second facial analysis. It monitors historical pain events and documents treatments, and it's all got self-guided in-app training. We released the product a few months ago, and we've had a lot of learnings, a lot of feedback, both from healthcare professionals and also from mums and dads. We thank those who've been involved for the feedback, and we've got into a period in the last 3 months where we've actually looked to significantly improve the product. There are things that need developing, and on the left-hand side here you can see key elements of it. It's mostly around pricing. We're moving to a 6-month annual and lifetime pricing, but also making sure that people put their credit card in up front, which means we're more likely to transition from trial to actually pay. We are reducing entry barriers by making sure that when you log in to PainChek Infant, you stay logged in. There's no need you don't log out and you stop using it, log back in again. So simple change that we're doing. One of the other changes is we've got feedback from clients saying, great, we've got the pain score, but what do we do now? We've refrained from giving guidance as to what to do in the past, but we've now worked with the CPR Kids Australia, and we're building in that education as to what to do after you get a pain score, how to manage that situation and what to do. So that education on the right-hand side we talk about there is coming into the product. We're going to improve the journey. We can have welcome emails, first assessment milestones, just encouraging constant utility of the product, like most apps do. And once we've got these things done, we're going to then really start the marketing campaign more aggressively this quarter, including Google search, Facebook, and Instagram. The other thing that's been worked on is extending the age range for the product to toddlers. So currently it's 1 month to 12 months, but we're going to move that to 18 months with the data we've collected and the training of the new product. And finally, we are working or coming back to rework on the vocalization app. We had to put that slightly on hold during the FDA process work because that took up so much time and effort. But the vocalization app is being developed for use as a specific product. And the 3 different scenarios of how it can be used is described very much in the quarterly. So that's the summary of the core business, and it's reported in much more detail in the quarterly. I encourage you to read it, and if you do have questions afterwards, please let us know. What I'd like now to do is move on to the US and our marketing launch. As you well know, we actually got clearance in early October. We spent some time in the US. We exhibited at various conferences. We got our first customer agreement also in October. We've got another one since. So we've got 2 key reference sites set up in the US. And in the last month, we've been re-looking at our strategy and also at our reimbursement opportunity. So let me just talk a bit about that and about the announcements that we produced yesterday. So if you first of all take a step back and think about what we have, we have as PainChek the only FDA cleared medical device for pain assessment. The de novo clearance came to us in October. What does that mean? It means 3 things in terms of opportunities. Firstly, we're selling already into the world's largest healthcare market. That's about 1.5 million people living with dementia and aged care, and that's worth $150 million per annum as on our core SaaS business model. And home care, there's about 3 million people living with dementia, and therefore a potential $300 million market opportunity with the SaaS business model as we expand into home care. But one thing FDA clearance also gives you, it means you become a medical device. And with a medical device, you can get access to reimbursement codes. And there are 2 ways of doing this. One is either you get your own code, which is always assessed by the Centre for Medicare and Medicaid Services. And we know they're reviewing that right now with an April deadline this year. The first 3 months is a black box, and the next 3 months we can negotiate. So we're talking to them to see how they see it. The other option is to explore existing RTM codes or reimbursement codes which are applicable. And yes, RTM codes, we believe, and we've confirmed now, are applicable to us. The third area, which I'm not going to touch on today, but new initiatives in the US in home healthcare, encouraging home products like ours to go into home healthcare more rapidly. There are 2 new initiatives called the Access Program, the Tempo Program, which are asking for inquiries and submissions by the 1st of April, and we will be making a submission for those as well. So 3 channels for us to go into the market, but the newish one is the one right in the middle there, which is the RTM codes. We investigated the codes over the December period. We engaged with a group called Nixon Law who specialize in this area and to give us legal counsel opinion. And they came back to us just 3 days ago, and they reconfirmed that PainChek qualifies as an appropriate medical device for purposes of remote therapeutic monitoring reimbursement. Because amongst the requirements is the number 1 requirement, a doctor must use a medical device. And a medical device is something that's FDA cleared. And the medical device should collect and transmit appropriate therapeutic data through it. And of course, what the PainChek system does is it assesses pain, which is related to therapeutic data. It then allows the doctor to treat based upon the diagnosis. And then afterwards, when you reassess, it shows the doctor the impact of the therapeutic drug. Therefore, through that therapeutic message, the PainChek device meets all requirements. So that's documented, and we now can start selling immediately through the RTM process. So what does it do, and what pathways does it open? If you look on the left-hand side, so the remote therapeutic monitoring codes were created specifically for non-physiological therapeutic data. You can see there it's about therapy adherence, therapy response, and the one key area is the musculoskeletal system. Musculoskeletal system that links to pain, functional status, and symptom trends. I'll come on to how the musculoskeletal system works in a second. If you look at the US market, well, we know there's about 1.3 million nursing home residents in the United States. We know that 40 to 70% are likely to have MSK, musculoskeletal prevalence. So it means roughly somewhere between 500 to 900,000 people living in aged care or long-term care with dementia. And we also know that if you look at the data projections, that the RTM market is projected to reach about $3 billion by 2030, of which musculoskeletal issues are seen as the strongest and the largest driver for those claims, because that is the biggest problem. So let's talk about how PainChek addresses that problem. And what's our unique advantage in remote therapeutic monitoring? Well, if you look at the top here, there's the three issues. One, there's a large number of people in long-term care and home care settings who cannot self-report. What that means, as the data says, this results in underdiagnosed MSK conditions. Because they can't self-report, you can't actually diagnose with a medical device, diagnose before PainChek with a medical device for those MSK conditions. And what that means, if you can't use a medical device to diagnose and show the treatment works, you can't bill for those residents. So that's been the issue to date. You can't bill unless you can show evidence that the treatment has actually done something. So PainChek solves this problem. How does it solve it? Because we detect pain objectively in those non-verbal patients. We link the pain scores with the MSK diagnosis, the musculoskeletal diagnosis. So things like osteoarthritis, fractures, joint pain, post-operative pain. We link the two together. We provide the therapeutic response data. In other words, you've given a drug, here's how the drug's worked, which aligns with the RTM intent. And then we support the claims, and I'll show you the claims in a second, for the 2 and 15-day rules and the ongoing management. So PainChek is positioned as a compliance-ready MSK musculoskeletal remote therapeutic monitoring enabling device, as well as being a novel pain assessment tool. So let's have a look about how this changes our business model, because we now have two business models for the United States. So if you think about our core business model we've always used is on the left-hand side. So we provide an FDA-cleared medical device into, say, skilled nursing facilities for them to use for their day-to-day care. That is our classic SaaS license of $50 per bed per annum or higher, and we're going with $50 plus US numbers, and that's working very well. And therefore, is an estimate $150 million per annum. So that's how we work today, and we have SaaS agreements for that sector. A skilled nursing facility uses the product and uses it daily for the quality of care and medication management, and they are funded by Medicare automatically. So they pay for it out of their Medicare funding. Now, the skilled nursing facility also has a service agreement contract with what they call a qualified healthcare professional. And they provide services to skilled nursing facilities. They provide specialist services like physiotherapists, physicians, occupational therapists, GPs. And they come in to give that specialist support in managing those conditions, such as musculoskeletal conditions. It's this group that bills CMS and Medicare for things like remote therapeutic monitoring. So what the business model, how it evolves now, is we're on the left-hand side with our skilled nursing facility. That remains the same. But in addition to that, we now appear on the right-hand side. And we can work with those groups of qualified healthcare professionals to supply PainChek as a cleared medical device and set up, as you can see in the bottom here, a device service agreements as a new RTM revenue stream. So as the qualified healthcare professional group use the product, they bill RTM codes. We then have an agreement on the right-hand side between them to have a share in that process. And we agree a pricing for our product, and they do the billing and collect the funds and then pay us through that. So we've got two models that we can service going forwards. And the one on the right-hand side is worth up to $3 billion per annum. Let's just quick look at what those, and this explains why they're worth so much, because this is the codes that link to remote therapeutic monitoring payments. And the point about this is it's not an a la carte. It's not, I can pick this one or this one or this one and just do what I want. It's structured in this order because the goal from CMS is to ensure that doctors do the three-step process. before they make their claims. The first step is to set up the device. As you can see, that's the first category. The second step is to capture data using the device and therefore monitor the pain. So you either go with the 2 to 15 days or 16 to 30 days. And then the third step is then you do consultation with the clients or with the healthcare facility, with the dementia patient and the family in terms of what the results were and how to manage ongoing. And if you look on the right-hand side, those payments are monthly payments. So to set up the device, you get $20 per episode, per patient period. To capture the data, you get $51, either the 2 to 15 days or 16 to 30. You can't do both, just one or the other. And then for the ongoing treatment and monitoring, it's $26 for the first 10 minutes, $50 for the next 20 minutes, and then $39 for 20 minutes after that. So it's a significant amount of money each month that can be used by managing and providing care. So what's the options for us as PainChek in terms of the business models? Well, there's two classic ones that are being used broadly today. And I'll go through the two options. So on the one on the left-hand side is a very simple model. It's called a per member per month fee. If in the situation here where, let's say, the healthcare professional, you look at those numbers before, let's say he bills $150 per resident per month on average because of the work he does, then we agree a fee with the healthcare group based upon the fees he's expecting. So we will fix a fee for providing the product. He pays our fees for the product. He collects the money. It means we get a fixed margin. It leaves the provider with a strong ROI, and it's predictable revenue for us, regardless of the payer mix or the collective reimbursement. That's the simplest model, and typically companies get between 25 up to 50% of the RTM claims. The other side is maybe more. There is also a hybrid model, which is more low touch. This is more for clinics cautious about upfront commitment. We would charge a lower PMPM fee, but we'd agree to collect an agreed fee based per patient on the actual reimbursed collected fees. And again, that will be a fixed number agreed up front and reviewable on a quarterly basis. What that does, it protects our margin, it sees us as a partner, and the revenue can grow because often a commercial payer gets a higher price than the Medicare rate. So both models seem to work, and both models are significantly higher in terms of value than our current SaaS direct to aged care facility model. So as you mentioned, I'm going to come back to later, we're going to launch this at HIMSS in early March. That's where all of these clients come and all our big partners and all the big players in this field will be. And what's the message? So the message to healthcare professionals, it's really simple. We enable enrollment into RTM MSK programs. You can actually use PainChek to go into that, and you can produce revenue through the three-step process: the setup, the device supply, and the treatment. Yeah. Therefore, you can support dementia care, you can address MSK issues, and you've got defensible documentation for audits. That's the message to the healthcare professionals who make the claims. Their message and our message to Medicare, we are providing a tool that addresses the musculoskeletal digital model care that they want to manage. We know if you manage musculoskeletal issues better, we reduce avoidable ED visits, we reduce falls, we improve analgesic mismanagement, which is the core goal of CMS, and it supports the quality measures in terms of managing pain, function, and medication safety. So unique messages can be provided both to the HCP and to the Medicare funders. So what's next steps? Well, two questions I always get asked, and I want to try and take these in the talk. First of all, how quickly can this work? How rapid is this? Well, it's immediate. We've got two business models now. We've got the long-term care SaaS business model, which is the one we have in Australia and everywhere else. And remember, we've never had the opportunity to get reimbursement in Australia or the UK. It's always been out of pocket expenses for the aged care facilities. But now we've also got the remote therapeutic monitoring reimbursement model for those healthcare professionals, qualified healthcare professionals, and giving them ROI benefits. So we're going to launch this in HIMSS, where the clients will be and where the partners will be, and the key message will be PainChek. It's an ROI opportunity through enabling RTM reimbursement codes. That's the key message. And in terms of implementation, well, we want to extend partnerships with those who have existing RTM infrastructure. There's a lot of companies out there in the US who've got that billing infrastructure. We started talking to a number of them already, including our current integration partners in the US who have that infrastructure built up and have already contacted us and said, look, we'd like to have a conversation. We believe you're going to get reimbursement. We should have a conversation. We're also talking to a number of other interested parties who service different segments of the market. So it's not just aged care, but as we go into home care and other sectors, RTM applies across both aged care and home care. So real massive opportunities. And finally, we will obviously continue to negotiate with CMS because they may still come back to us and say, look, for aged care facilities, rather than paying out their Medicare budgets, we're going to give you a specific code. So that addresses the left-hand side of our business model, but then leave us free to work with qualified healthcare professionals on the right-hand side of our model. So that could also be a significant win. So I'm going to sort of wrap this up and say, look, this is where I started, but there's one other element. So you can see we've got access with our core business model. We've got access through reimbursement codes and potentially new ones also coming forwards. And we're investigating this home healthcare opportunity with the access and tempo. But there's one more thing I want to share with you, and it comes back to this three-step process I talked about. 3 steps to claim for RTM. You've got to set it up, you've got to assess, you've got to look at the results, and you've got to document therapeutic treatment. Right now, there is one more element. The PainChek app is aligned to those claims. But also our US patent. We have a US patent. In fact, we have a patent in many countries, but our patent is exactly linked to that 3-step process. So you assess pain using PainChek or the PainChek concept, using cameras, etc. We've got a patent on the process. We assess the pain. The doctor then treats the pain, the therapeutic drug, and then comes back to reassess the impacts of the drug on pain using PainChek again. That 3-step process is how our patent works. And our patent is valid till 2038. To be frank, this is a significant point because if somebody wants to come along, I know that some people are saying, well, PainChek is AI, anybody can copy AI. Well, they can't. There's 2 reasons. One, if you want to bring your product into the market in the US, first of all, top left-hand side there, you've got to get de novo clearance. That will take you 3 or 4 years. Yeah, or you've got to get clearance based on our de novo. That'll take them 3 or 4 years to do the studies and the clinicals and the validation work. On top of that, if they come in and try to claim codes, well, we've got a patent protecting it, and they will be infringing our patent. So I'm going to hold it there and pass it back to Matt for any questions. Thank you.
Thanks, Philip. As you've alluded to, we'll jump into some questions. As a reminder again to everyone in the audience, if you have a question you'd like to submit, please type it in using the Q&A function within Zoom. Phil, the first one, and I know you've touched a fair bit on the reimbursement side of things there, but how does the company see the US RTM reimbursement pathway scaling, and what milestones should investors look out for over the rest of the year on that front?
Good question. I would say a milestone to look out for is partnerships. First of all, partners with healthcare professional providers, those groups. We've already got 1 or 2 reached out to us to start. So they've recognised it talking to their aged care facility that this is an option for them. So we'll get some of those pilots going quickly. We've already got one or 2 people we're talking to now. And secondly is as we build our capability in with our existing partners, in the US, existing integration partners who provide those billing capabilities, by the way, then that will be a second point. And of course, the third point is how the first pricing models we come out with that seem to work for both ourselves and the healthcare professionals. And we should be in a much clearer position by, I would say, we're end of January here by sort of early March, mid-March to late March, post the HIMSS conference in the US.
Thank you. The next question is, what initiatives do you have in place to accelerate the transition from contracted licenses to implemented?
Well, I think I showed there we've in the last 2 months we've done three things. One, we've changed our contracts, so all our contracts now that have been issued now have fixed implementation dates. Yeah, so there's no it can't lag, and those fixed implementation dates are within 2 to 3 months on average. Depends on the size of the client, obviously. The small ones faster, the large ones bit longer. Secondly, I think I mentioned in our talk we've actually significantly improved our implementation of the last quarter, so that's all happening. And thirdly, our contracts are going out for 2 years these days, and therefore we're not needing to renew, and we just keep the implementations as they are. So the contracts, I would say, number one, and secondly, the sense of urgency from our clients to get the product in and up and running.
Thank you. There's been a couple of questions around ARR and the expectations there, and obviously conscious we can't provide any sort of forecast, but do you just want to give some colour on how investors should look at the cadence over time?
I think the next 2 quarters, we see very, very strong growth in the next 2 quarters. We've got a 2 million ARR immediate opportunities in terms of our pipeline. And I've said before, we've already got 30,000 beds we're looking at in the US. It's not qualified yet, which are not included in that. So I see very strong next 2 quarters. I'm talking about UK team, talking Australian team, talking the US team. These guys talk daily, all three of them, and the pipeline's building very nicely because PainChek is seen now. One thing about the FDA clearance, I know it's United States, but that message gets across to other countries. And one of the messages we're really pushing hard now, it says something like you wouldn't use a non-medical device to assess a medical procedure. So why would you do that with pain for people who can't communicate? The old systems of AV pain scales and stuff are non-medical devices. PainChek is a medical device recognized by TGA and everyone else, and now recognized by the FDA with the clinical study. So it's really working well. And we've already got 35% penetration in Australia. We're growing. We're going to continue to grow in the UK, but the big opportunity now is having that reimbursement opportunity in the US because we've been selling without reimbursement, and now we can go into the largest market in the world with a reimbursement opportunity.
Thank you. And on that note, you've announced previously around having some personnel on the ground in the US, and I know you've been over there yourself. Can you just speak to how that looks going forward?
Sure. Sorry, I should have given more detail. No, we have five people on the ground now in the US. We've got a head of business development in New York. We've got BDMs in Boston, operations managers there as well. We've got head of sales in Canada, and we've got a BDM in Canada based in Toronto as well. And we're providing a lot of support to them from the Australian group, but we're also leveraging our partners there. Our partners are really see the opportunity, and we're working very closely with them because one of them has already got a reseller agreement, and another one we've got strong integration agreements and strategic partnerships. So the combination of that is good, and our team on the ground are solid. I think we do cover it in the quarterly. They've got great experience in aged care. They've got great experience in healthcare, and also in very much focused on sales. So yeah, small team, but growing, and I'll be with them obviously by the end of February and the HIMSS conference.
Thank you. Someone has asked, Scotland meeting next week. What is the likelihood of signing up commercial agreements and when?
Well, the Scottish meeting was actually this last week. Today, there's announcement, joint announcement coming out from ourselves and the Scottish Care Inspectorate about the results of the care work. It's very positive. It's actually been published today. I'll make sure you'll see it in social media. You'll see it through various channels. I can actually forward it on to people as they want it. And what they're doing now is they're looking at how they can potentially roll this out across Scotland. We've already got a significant number of the aged care facilities in Scotland using the product. So it's not signed off yet, And I think there'll be a more natural process where basically there's funding given to the aged care facilities for PainChek. We're not quite there yet, but read the results. It's very, very significant, and it's actually in the quarterly, the Word version of the quarterly. Have a look. It's got great feedback from the Scottish Care Inspectorate.
Thank you. Another one is, how can the growing PainChek data set be leveraged to create additional opportunities over the longer term?
Sorry, Matt, I didn't quite hear you.
It was, how can the growing PainChek data set be leveraged to create additional opportunities in the longer term?
Well, it's certainly most of that data set well, I would put it this way. We provide a core data set for our clients, which is supporting them in terms of their work and gaining their uptake. We do see a future where that becomes a real value-added service that we can actually charge for, where we can actually start providing specific data, specific reports, especially for things like reimbursement and claims, etc. So right now it's free of charge, but going forwards, we see it as a value-added service that we can charge for. While we collect every single data source, we don't get the names because that's obviously, it's private and confidential information. But it also helps us with our product, because what we can see, if we can get trends across everyone, we can maybe see how we can improve our product to maybe make it even faster and to make it a bit more predictive. In other words, if you see a certain pattern over the 42 test points, we can start making more predictions of what the cause and effect is. So yes, it's got a great value, and it can be used for both product improvements and it can be used for a value-added service, chargeable.
Thanks, Phil. There's no more questions in the queue, so I'll throw it back to you just to provide a closing comment.
Well, I just like to thank everyone. I know it's been a difficult last couple of months. I know that, since the FDA clearance, people were obviously expecting everything to explode in the United States, and it didn't. It takes time, but I think we've got the team in place now, and we've got, the strategy right. We've got this new opportunity, and to answer the two key questions, was ask, how fast can this be now? Well, this can be significantly faster now because of the reimbursement opportunity. And secondly, remember, I don't think you will see any competition from PainChek for the next significant number of years, for two reasons. One, it's a high barrier getting FDA clearance. And secondly, we've got a very, very strong patent protection, which is totally linked to the RTM process. So if anybody tries to claim using a product for RTM, they'll be infringing our patents. And if I can say, I worked for Roche for a number of years, and Roche, I don't know if you know this, but about 40 years ago, Roche bought the PCR patent. They bought it for about $400 million. And today they make billions of dollars using it for both for their products, in terms of diagnostic products, and also for licensing for those people who want to use the product but can't do because of their patents. And their ownership of the license. So we're not saying we're in that sector, but I've seen how that works and how that brings great value to a business. And we've got similar values in terms of our product and our patents. That's it.
Thanks, Philip, and thanks to everyone for joining, and we look forward to bringing you more shortly.
Thank you, everyone.